and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of KevinMD. Rate and review the show at kevinmd.com/rate. Subscribe at kevinmd.com/follow. Today in the show, we have Adrienne Van Curen. She is an emergency physician. She wrote the KevinMD article, "Are My Coping Skills a Result of My Emergency Medicine Training?" Adrienne, welcome to the show.
Thanks so much for having me.
We'll get into the article in a little bit, but first off, can you share your story and journey to where you are today?
Sure. So I currently am an emergency medicine physician in Atlanta, Georgia, and I grew up in Georgia and went to undergrad and med school here. And then I moved up to Massachusetts for my residency. And right out of residency, I worked in a community hospital, which was kind of perfect for me then. It was a lot of bread and butter emergency medicine. I saw a lot of patients and did a lot of procedures and kind of gained confidence as an attending. But it was clear to me pretty quickly that that was not going to be a good long-term fit for me. So my husband is a computer engineer and wanted to move back to Atlanta for a startup. And so when we came here, I took an academic position just because I knew it would kind of afford me some more opportunities with my career. And so I've been with Emory now for about 6 years, and August of last year, I decreased my clinical time. I went for the first time in, since residency down from full-time to half-time, and I enrolled in the MPH program here.
Sure.
So I'm currently doing that. And then, I'm married and have 3 school-age daughters who I'm also pretty involved with. So busy.
Busy. I'm sure I have 2 school-age daughters, so I can certainly relate to what you're saying. So you said that you mentioned you practice both in a community and academic setting. When it comes to emergency medicine, what are some of the major differences between those 2 settings?
Well, I think one thing that's kind of interesting about emergency medicine, and it's probably true for all medicine, is that the hospitals and the location change the whole job. So, I think in the community hospital that I was working, there were some residents. They were not emergency medicine, they were internal medicine. So there was a little teaching, but definitely not as much teaching. And then also where I was, I worked near Boston. And so there was, of course, some big tertiary care centers there. So I didn't see a lot of the really specialized patients that I take care of now. So it was a lot more of the kind of straightforward pathology. And also there's a huge opioid problem there. And so that was a really big part of my practice there, which was also part of, I think, what was a little discouraging to me. And I know in Atlanta, there is still the opioid problem, but I don't think it's as robust maybe as in New England. And the patients I take care of here are much more complicated. So I like it because I feel like I see something new every day, something that I've never even heard of. So I feel like I'm constantly learning, and I felt a little stagnant in the community role.
All right. So let's talk more about your KevinMD article. It's titled, "Are My Coping Skills a Result of My Emergency Medicine Training?" Now, for those who didn't get a chance to read your article, can you just walk my audience through it and share the story of why you decided to write it?
Yeah, so the article is based on my experiences over the past year, really. So, in February of 2021, as a full-time emergency medicine physician, I was feeling, as far as work, pretty stressed out to the max. I would say I'm burnt out with the pandemic. And I was working a shift one day and got an email from one of my brother's close friends that he had become really sick and was hospitalized, not at the hospital I work at, but a little bit north of me. And he had a diarrheal illness and just really severe fatigue, and was pretty quickly diagnosed with widely metastatic colon cancer. And so that was, his hospitalization and ultimately death was very difficult. And the first week that he was in the hospital, we couldn't visit because that was still when the COVID precautions were pretty strict. And then we transitioned to hospice. And ultimately, I did feel like under those circumstances, it was a nice death. We got to have a lot of conversations about how he was feeling, and I know he was comfortable. He, was lucid and able to like be involved in all the decision making. So I think under that circumstance, things went as well as they could have. Afterwards, I don't feel like I dealt with his death in a very healthy way. I internalized a lot of my feelings, and I didn't really talk to anyone, maybe my husband, but because I think I was kind of this person that has always been trying to like project this, mentally strong persona. And maybe we all do that as physicians. I think we learn in med school that, you have all sorts of things thrown at you and you kind of just take it and move on. So anyway, I dealt with that kind of by myself, and 6 months later felt like I was doing much better. I was very sad about his death, but had gotten to a much better place. And then I got a phone call from my stepfather that my mom had died. And she was on Eliquis because of AFib, and she had some kind of injury to her leg when she was at home alone. He had been out running errands, and she hadn't met him where they were supposed to, and came home and found her. And so with her death, I don't know if it was that our relationship was very different or just the circumstances of the death, but it had a much different impact on my mental health than my brother's death. And even COVID, I had felt stressed about COVID, but I really began to have kind of uncontrollable anxiety. I was perseverating on the circumstances of her death, and, just spending so much of my time thinking about how she was at the end of her life. And then I think when my mind ran out of possibilities to worry about that, I started then worrying about my own family. My daughter would cough, and I was convinced that she was going to die because I was thinking like, I'm this person that terrible things are just going to happen to now, And at work, it was interesting because I really felt like the stress of work was not different for me. I felt like I was doing fine there. It was really like in my daily life, just tiny things that normally wouldn't have given me pause were really sending me spiraling. So I mentioned this to one of my colleague friends, and she really encouraged me to take advantage of the therapy services that Emory offers to staff. And I was very reluctant to do that. And that may be also something that other people can relate to. I think I kind of felt like it was an elite privilege, and felt like my life wasn't that bad compared to other people, and also wasn't sure like how it could help me. But I was in such a bad place at that time. I was really like physically not feeling well every day, and also, just not enjoying my life and worrying so much. So I did it. And, now it's been about 6 months since all of that. And I did also take some medication for a few months. So I don't know if it was time or medicine or therapy or what, but I'm, in a much better space. I think the therapy was a big part of it. I think we're all like pretty evidence-based. So obviously this is anecdotal, but, I learned, I think, some better coping skills. And so this article resulted from me, one, returning to writing a little bit more. That was something I hadn't really done for pleasure since high school. And my therapist, Lissa, recommended that I kind of lean into that and maybe journal. And so this was based on some reflections I had during that time. And then, another thing is that during my sessions with Lissa, we just kept coming back to the fact that I would worry about these scenarios and then try to go through all the possibilities and try and figure out the way that I could perfectly manage all those possibilities. And, she pointed out that a lot of the times there were infinite number of possibilities, and also I could not solve any of them. A lot of the problems that I was bringing up with her were things that were really out of my control. And, she pointed out that I was expending so much energy this way and really not accomplishing anything.
Sure.
And what I thought was interesting about that is that I feel like that kind of like flies in the face of emergency medicine training. I think we are taught in emergency medicine to train a lot, especially for these like very high risk, but also very low probability events. Because you may see them once a career or never, like, a perimortem C-section, or having to do an emergency crike or an emergency thoracotomy for trauma, but they're things that we're expected to be able to do. So, I think we're encouraged to do sim labs and cadaver labs and mentally rehearse these scenarios. But you could spend every minute of your free time doing that and still tomorrow walk into a shift with a condition that you didn't think of. So I think trying to figure out how to move forward with emergency medicine, but still maintaining that mentality of like accepting the things that are out of my control has been a challenge. And it's something I'm still working on with her. And I don't know the solution, but it was just kind of interesting, I thought. And I started to wonder if that was a common, if other emergency medicine physicians were the same. I know we have a very high rate of burnout. And I wonder if, some of that has to do with just all that pressure that's on us.
So you mentioned that if it wasn't for the nudge of your colleague or friend, you probably wouldn't have pursued therapy. Do you think, had you continued on the path, is that something that eventually you would have come around to? Or did you need that nudge to take that next step?
I really think I needed the nudge from her. I mean, honestly, this came from a person that I really respect too, and that I think of as very like mentally strong and tough. So of course I had thought about therapy at other points in my life, going through things. And like I said, I just think I had too many reservations about it. I don't think I would have done it if it hadn't been for that nudge, and probably also from like this specific person.
Sure. And you mentioned this earlier, but specifically, what were the reservations that you had that prevented you from going to therapy? Was it the proverbial medical school residency mindset, not to show any vulnerability or weakness? You mentioned something about privilege, but specifically, what were some of those biggest reservations you had?
Yeah, I mean, I think there's like the medical school mentality of going through that hazing that we all go through, and, being expected to not show any kind of emotion, or like just being able to like cope with every single thing that you're dealt with and move on and get things done. And then, I grew up in a family also that certainly would not have encouraged or been open to therapy, and probably would not have supported me in that. So I think that was probably a big part of it. And then, of course, with the privilege piece, I think whenever I thought about it, part of me was like, well, my life is so good compared to so many people. And it felt kind of silly and something, it's hard to describe, but I just had guilt about having access to those services when there are people that have so much worse life conditions and situations that aren't able to do that. So I think those were the main things. And I think also there was, I do think finding the right therapist is so important. I was lucky because, Emory has a system where you can read the bios of the various therapists that they offer. And then I met with one of them, and she actually referred me to someone in the community that she felt would be a good match for me. And so I was very lucky also in that, because I think the other part of it was that I had heard that, that you need the right person. And I think I knew too that if I didn't have the right person to talk to, it wouldn't really work well. And the idea of like spending my time trying to find that connection and also like share my story so many times just seemed exhausting and overwhelming.
Now, you mentioned coping mechanisms that you learned and are still working on. I'm sure a lot of emergency physicians are in your similar position, dealing with a whole host of issues. What would you say are some of the biggest coping mechanisms that worked for you?
Well, I think, and before this, like getting regular exercise, trying to take time for my family, setting boundaries with work, those are things that have helped me. When I had these 2 deaths, that wasn't really enough. So I think the things that Alyssa taught me, she practices ACT therapy, which is acceptance and commitment. And so a big part of that is when you're feeling anxious about something, to first acknowledge it, which is something, that I think a lot of us don't do. We kind of just like try and ignore it and move on, even though you're like, why am I feeling this way? And then to think about what the reason that you feel the way that you do, and like what values that reflects. And then the third part of that is to act. For me, she pointed out that my ACT piece was actually kind of just like sitting with that a lot of the times, because so many of the things that I was worrying about were again beyond my control. Because I think a lot of the things that I worry about that I can control, I have controlled. But the things that I was worrying about, like how is this death going to impact my relationship with so and so? That's not something that I can fix. I can show up and be whoever, but I can't fix all of those things. So I think I've gotten much better about that. When I can feel that I'm anxious about something, just kind of working through that process. And then when you get there and you realize I don't have control over this situation, I can't fix it, just letting it go,
Sure.
and moving on. It took a lot of practice for me to do that, because I think it's easy to say those words, but then not actually do it. But I do feel like I've gotten to a place where I can do that a lot better. And I think that's the main thing that helped me through this is just kind of working through that process of accepting that a lot of things are out of my control and I can just do what I can and it's okay.
We're talking to Adrienne Van Curen. She is an emergency physician, and she wrote the KevinMD article, Are My Coping Skills a Result of My Emergency Medicine Training? Adrienne, as you reflect on the past few years and everything that you've learned, what are some pieces of advice or wisdom that you could share with other clinicians where your story may resonate with them?
Yeah, so I think there's a few things. So, another thing that I kind of touched on in my article is that there are, I think, a lot of nuisances of the job that I think are not just emergency medicine, that we all feel, the pressure to see more patients, the charting, specifically to emergency medicine. We have patients that are angry about the wait. Sometimes we have consultants that are not understanding of the environment of the emergency department. And I think one kind of beautiful thing that I saw come out of COVID was these groups of people joining together and kind of saying, like, I'm not willing to work in this kind of environment anymore. Whether that was like, I'm not going to come back to the office when I don't need to, or not going to work for this amount of money. And I think physicians are so smart, but I wish that we could come together a little bit more and maybe say, like, we also are not going to, because I think also as a group of people, we tend to just kind of take whatever people throw on us. Like, oh, I need you to see 5 more patients a day. Okay, I'll do that, So I think that's one thing that I think would be nice if physicians started saying, like the rest of the world has, I'm not going to do this. And then for me specifically with my mental health situation, I think therapy is probably good for all of us. Wish that we could remove all the stigma around it. And I think if people could find the right therapist, that probably we would all benefit from it. So I would encourage anyone that has access to those services. And I think a lot of physicians do, even if their particular hospital or group doesn't provide them. ASAP I know has some, and there's some other, which is an emergency medicine organization. But I think there's probably other organizations that people could access that through. And then I think also specifically for physicians, allowing yourself to be vulnerable. With my brother's death, I think I was sad later that certain people hadn't showed up for me. But then, Lissa, my therapist, pointed out the fact that, if you make yourself seem invincible and like nothing bothers you and you're doing fine, people don't know that you need help. And so I think it's okay to say, like, I'm really sad, I'm really overwhelmed, I'm exhausted, to people that you trust. Obviously you don't have to share that with everyone. And just to ask for help when you need it. I think that's been really hard for me too. And obviously writing this article was me practicing that. And it's been nice because I have heard from, people that I don't know, that said that the article really resonated with them. So I think we all feel isolated, but maybe if we were all a little more vulnerable, we'd realize that I think we all feel the same way. I think we're all stressed out, and this has been a really hard 2 years, and I think people want to help you if you let them.
And my final question, what are some of your take-home messages that you want to leave with the KevinMD audience?
Yeah, so I think focusing on your mental health is important. I think that would probably be my main message. I think we as physicians are trained to take care of other people, and we want to. I think that's probably what brought a lot of us to medicine. I think I wanted to help the suffering of other people, and you really can't do that if you are not mentally well, and you also can't show up for your family. You can't enjoy life if you are ignoring your mental health issues. So I think that would be my main takeaway, is to, when you're struggling, acknowledge it, and then try and figure out what it is that would help you and focus on that, because nothing else matters. Nothing else is going to be fulfilling if you don't fix that part first. So I think that's the main takeaway I would have with this.
Well, thank you so much for sharing your story, time, and insight. Thanks
Yeah.
again for being on the show.
Thank you so much for having me. I really enjoyed it.